In this video, I'm going to talk about what is the process of getting your patients to do the home exercises 100% of the time. Hi, this is Dr. Steve Young, owner and founder of Body Solutions. So in the past, I've talked about automation and business and fitness and profits and revenues and all that stuff. All that stuff is awesome, but I feel like in the industry, we're not being taught in school or even out of school what is the process of getting our patients to do their home exercises, right? Because we all know as clinicians that if your patients don't do their homework, they pretty much do not get better, or they get better much more slowly, right? So what is that process? And so think about it. When you set a goal for your patient to be pain-free, let's say they want to climb the stairs, or let's say you set some type of functional goal, you have to ask yourself two things. One, is that motivating enough for that person, right? Is that functional goal of being able to climb the stairs, because we had to document that in the charts, is that enough of a big enough why for the person to actually do it? Because I challenge you and invite you to think that it may not be. That might be a goal that you document for the insurance companies, but they may not be the same goal that you want to set with your patients, because we do things based on emotions and we justify it with logic. These logical, measurable goals may not be enough fuel to motivate your patients. So you might want to set emotional goals. How are they going to feel when they accomplish blank, right? So that's part one. Part two is recognize that when you set these functional goals with them, as they get closer to the goal, their motivation actually decreases. Let me repeat that. As they get closer to the goal, the motivation actually decreases, right? Because, for example, once they climb the flight of stairs, their reason to do their exercises is gone. They've achieved it, right? They now have to set at least a different goal, maybe to maintain that, right? Some type of other goal to get them to continue to do their exercises, right? Because you and I both know when your patients are done, most of them should continue to do some type of work, right? And so why not set a goal from day one that makes them and helps them be extremely motivated to continue this lifelong journey of moving, stretching, strengthening their bodies, and not temporary goals, right? Temporary goals are all of the functional goals that typical physical therapists are doing, right? You can set bigger goals, right? For example, you can set a goal, like we just told patients today, let's set a goal to spend 30 minutes each day for self-love and self-care. I don't care if it's stretching, strengthening, combination of both, meditation, just sitting there and just being with yourself. That is the big goal. How are we gonna do that? Well, we're gonna fill it in with some stretches and exercises. But the big goal is lifelong 30 minutes each day, because that goal is what I call an infinity goal. It doesn't end, right? You won't run out until they die and they don't need it anymore. And so that's an example of these bigger goals to set. So if you're interested in that process, I want you to click below and reach out to me. I want to be able to help physical therapists be able to have a package or a program. If there's enough demand, I'm going to make it. We've been doing this in here for about 10 years now. I want to make a program that you can use to not only use it yourself, but if you have staff members under you, I want all of your staff members, all physical therapists, it's my passion, to teach this process on how to set the proper goals. How do you get your patients to motivate themselves, right? So they actually do their homework, not only while they're in physical therapy so they get results, so you wow them, but for them to keep moving their bodies so they live this life of health. So just click below if this sounds interesting to you, if you feel like you want your clients and your patients to change their lives.